Hello again if you were brought here from my How to Brush Baby's Teeth video. If you haven't yet watched that, I'll link it here in the cards, and you can learn how to introduce the idea of toothbrushing to your baby. Hint, it's before the teeth come in. And learn what tools to use both before the teeth arrive and after. In this video, I'm going to show you how to actually brush their teeth once they're in. But first, be sure to hit that subscribe button so you catch all the tips and information I share to help you care for your little one's mouth. So when should you start brushing your baby's teeth? If you watched my previous video, you know the answer is as soon as they come in. You want to use a true nylon bristled brush, i.e. not a training toothbrush like these. These have silicone bristles, not nylon true bristles, and they just do not clean the teeth very well. These are purely for desensitizing the baby to the idea of toothbrushing before their teeth come in. So these are really gum brushes, not toothbrushes. So those were just for cleaning gums and getting baby used to the idea of brushing before their teeth actually came in. Some of my favorite true nylon bristled toothbrushes are these. I'll talk a little bit more later about these triple-sided toothbrushes, but this Oral-B age 0 to 3 Winnie the Pooh toothbrush is a great place to start once that first tooth comes in. I talk a little bit more about toothpaste and fluoride in the How to Brush Your Baby's Teeth video. Again, I'll link that in the cards one more time. So if you want to hear more about that, go there first. As for how often to brush, the goal is similar to adults, or twice daily. As is true for grown-ups, the most important time to brush is at night before bedtime. You can start by incorporating toothbrushing into baby's bedtime routine and then add morning or before nap even brushing as a second time as your confidence and their comfort level grows. If you've always wondered why nighttime brushing is the most important, let me explain. Nighttime brushing is most important because when we sleep, our mouths become dry overnight, and it is saliva that naturally and normally protects our teeth. Without that saliva, the sugar bugs multiply and can produce acid, which weakens our enamel. The fluoride in your toothpaste helps to strengthen your enamel before this acid attack via the formation of fluorapatite, which dissolves at a more acidic pH of 4.5 compared to 5.5 of the natural hydroxyapatite that makes up your enamel. So you're essentially creating this outer shield of fluorapatite rather than just the regular old hydroxyapatite that's more resistant to acid breakdown. And you want to do that, you want it to be strongest right before that acid attack, which occurs overnight. When is the best time to brush during their bedtime routine? When your child brushes during the bedtime routine really will depend on what the routine entails. If there's any nursing, breastfeeding, or bottle involved, you want to brush last. The goal is to have the fluoride toothpaste be the final thing on your child's teeth before bedtime. What I mean is you don't want them to drink milk or rinse with water after you've already brushed. If the idea of not rinsing and or your child's not spitting well and this concerns you a little bit, you need to see first my Teach Your Child How to Spit video, and I'll link that here in the cards for you. That'll go into a little bit more information about why we don't recommend rinsing after brushing for young children and why you want to leave that fluoride there to do its job and to work, because it takes time for that fluoride to work, and rinsing washes it away. Suffice it to say that rinsing washes away the beneficial fluoride before it has time to work. And secondly, if your child isn't good at spitting, having them rinse will only result in them actually swallowing more toothpaste. If they're not good at spitting the toothpaste, they won't be good at spitting that water out either. So have them spit as best as they can, which isn't going to be very well until they're about 6. Really, age 3, it starts to come online, and 6, they've mastered it. And if you're concerned about any residual toothpaste, you can wipe off their tongue with a washcloth afterward. And then don't give anything to drink, so no milk, no juice, nothing in bed like in a bottle afterward. Now what about the wear of toothbrushing? When it comes to the wear, this may change as your child grows or if they become resistant to brushing in one location. Mixing it up helps a lot. For many young babies and even bigger kids, brushing in the bathtub is the easiest place. Just be sure they're supported, especially once they start to stand. Baby was sitting in the bathtub just playing, and I would kind of hop in behind him like this, and again I would support them kind of on my knee or back behind me so that they can't push their head back out of the way, like so. And then I would use my hands to retract their cheek and lips as needed and brush. So bathtub can be a great place because they're distracted playing with their toys. You don't want them to slip and hit the side of the tub or that water spout, which many a tooth has been cracked on either of one tooth things. So one of these is a wise purchase. Also, I'll share a little PSA with you from the 90s anxiety pack that was Rescue 911. Anyone remember that show? But there's an episode where a child falls on their toothbrush. And so way back here on the back sides of your throat, your carotid arteries run, and then even further back behind the backmost part of your throat rests your brainstem. So a blunt object injury falling on something like a toothbrush, a metal straw. There's a recent story in the news about a 4-year-old that nearly passed away from falling on their straw. These can be devastating injuries, not just horrific because there's a lot of bleeding, but also because it can result in the child passing away. So don't learn this the hard way. please. Don't let your child use a toothbrush like a toy, and don't let them use it unsupervised or unsupported. Teach a child to either be supported by you, the adult, or to be seated for toothbrushing. So if support is key, what is the best way to position them? I'm gonna have lots of demos and I'll show you what that looks like for these different places. In the tub, in a little inclined seat, can be one of the earliest places that you introduce toothbrushing. Often this is where you start brushing even before the teeth come in, where you're introducing it, just desensitizing them to the idea before they come in with just a washcloth. Another great spot is the high chair. Laying on the changing table also works for some children, but remember, most kids don't like laying back, so being fully reclined may not be something that most children like, but it's still an option if nothing else is working. It's worth a try. Resting in your lap with another adult holding their hands. This can be done across a chair in the knee-to-knee position when you go for your first dental visit, which, by the way, link in the cards, that first visit should be by their first birthday per the AAPD recommendation. That knee-to-knee position, that will happen at the dentist for their exam, and is also a way that you at home, if you have another adult to help you, can brush your child's teeth, with someone having the baby reclined in their lap, and then the other adult is across holding the baby's hands, and then that adult with the head in the lap is brushing baby's teeth. You can also recline them on a pillow, especially if they go through a stage where they've got busy hands. You can give each hand a toothbrush to hold. If that's not enough to distract them and you want to use your legs to help keep their arms down briefly, you can. I've got a busy baby, grabbing and pushing it away, and you need to brush their teeth to make sure they're healthy and strong. You can lay baby down, and obviously it's for a bigger kid, more like a toddler too, not this size. Their head is resting right here, maybe on a pillow, so it's up a little bit, and then you put your legs on their arms, and then you are supporting them. You might use this brushing buddy to help them stay open, and then a triple-sided toothbrush to clean quickly and efficiently. All right, sweetheart, we're gonna brush really fast. Let's count to 3. 1, 2, 3. And then lots of praise when you're all done. Way to go, you did a good job brushing. Next time, would you rather try sitting in the sink? Yeah. In terms of giving baby a toothbrush to hold, one of the ones that I like is by Grabease, just because it has this little flower around it that keeps them from gagging themselves. The Jordan toothbrushes I'll show in a graphic also. Those can be great because they're rounded on the end, and so baby can't push it so far back that they're going to gag themselves. But it's great to give them 2 brushes, one in each hand, to keep their hands busy, to also help them to feel like they're participating while you're brushing their teeth. My preferred spot to brush once they graduate from bathtub and get a little bit more busy is the sink. When they're in the sink, you want to keep each hand of theirs busy again, holding their own toothbrushes. So Jordan's or Grabease. And you are standing behind them, supporting them, reclining them slightly into your shoulder or your armpit or your tummy area to brush. So it'd be kind of like this. They're sitting into the sink or facing away from you, or they're standing on their stool, and you're kind of reclining them here, and you're not pushing them back. But the main thing is you just don't want the child, when you go to brush, to go like this and like push away from you. You want them supported so they don't really have anywhere to go if they're moving around. And then you can use your other hand to retract their lips, their cheeks while you brush, like this. And then if they're a little bit taller, like this, kind of into your armpit area. Once they're a little bit taller, you can position them on a step stool. I link the 2 non-slip ones that I use with my kiddos in my shop at themomanddentist.com/shop under favorites. And what you do is you have them on the step stool and you stand behind them slightly to the side and still supporting them, making sure they don't slip off the stool with the brush in their mouth and that they can't retract their head back, kind of move away from you brushing. I have another video showing that for you too. The 2-step stool worked from about 18 months until age 4, and then we use that single step stool from about 4 to 6 years. And then by around 1st grade, they're on the floor and they're standing like a grown-up would for toothbrushing. But I still, even with my 1st graders, stand behind, slightly to the side. His head is right here around my armpit area. I have my arm around the head to kind of retract the cheek and the lips, and I'm brushing. So that's just a really good way to get used to brushing, so you have stability, especially if from the beginning you have used that position. They're not going to buck and fight as much, and you're not having to like hold them. It's just stabilizing them so they don't move around. Another great tool, should your child struggle to stay open with toothbrushing, is the Brushing Buddy by Snoopy Bee. I actually have this affiliate linked also in my shop. It's actually under favorites or teething. I think it's a lot of different places. The cool thing is you can desensitize them to this by first introducing it as a teether. It has these nice little silicone ridges. They love to chew on it, play with it. So you can introduce it as a teether while they're getting their teeth, and then when you need to add it to toothbrushing, it's not a foreign thing to them. The nice thing is this little tail, it serves as a bite block or a mouth prop that you rest between their teeth that helps them to stay open. They can even be in charge of this. Put them in charge of something to help them feel like they are a participant and it's not just happening to them. I like that. Love these. To help brushing go more quickly in the case of a difficult brusher like this, a triple-sided toothbrush that cleans all surfaces of the teeth at once can also be very useful. And the two that I like most are Surround by Specalized Care Co or Fridababy's triple-sided toothbrush. You just want to make sure with Fridababy, it's the one with true nylon bristles and not the silicone bristles. They do have both. You want the one with true nylon bristles. Both the Brushing Buddy and the two types of triple-sided toothbrushes can also be found at my shop, themamadentist.com/shop. They're affiliate linked via Amazon if you want to support me in that way. They are under the toothbrushes category. If you'd like more tips for toothbrushing struggles, I have an entire video dedicated just to that shares my top 10 tips, and I'll link that here in the cards for you. Now, how do you actually brush the teeth? Is there a magic formula? How long do I really need to brush their tiny teeth? It can't be 2 minutes, can it? Well, first, there really are people out there trying to brush their baby's 4 teeth for 2 minutes. Please do not be that person. You don't need to do this. A good rule of thumb is 5 seconds per the number of teeth. So if they have 4 teeth, that's just 20 seconds. Your goal with toothbrushing is to clean all 3 sides thoroughly. Some children might let you do that pretty quickly. Others, it might be a lot of wiggling and finagling. It might take a little bit longer. But what you want to do is clean the tooth from the tip to the gum line on all 3 sides, the front, the back, and the biting surface. So the most often missed areas are typically the ones that are blocked by other tissues, especially when the baby's wiggling or tightening them, like their cheeks or their tongue. So the tongue side of the bottom molars and incisors is commonly missed because the child's moving their tongue around, the cheek sides of the top molars because they're tightening their cheeks, and then the gum lines of the front teeth under the lips because they're tightening their lip. A brushing buddy and a triple-sided toothbrush again can be helpful if they bite down, tighten their cheeks and lips, and or brush with their tongue. There's one spot that people miss just because I think it's out of sight, out of mind, and that's also the backs of the front top teeth. Be sure you clean that well too. To access the backs of those top front teeth and the bottom front teeth, just turn the brush straight up and down. It will splash your mirror a little bit more, but it'll be a little more narrow to get in that area well. One thing I want you to get comfortable with doing is sort of brushing from behind. So you're going to have to retrain your brain a bit like a dentist to work upside down and backward. So I'm sure that's why it's a little easier for me and may be more of a learning curve for parents. But you want to get used to them being in front of you and you're kind of upside down and looking and using both hands. You're going to be using your right hand to brush, but your left hand is going to be working to pull their cheek back, like so, or lifting their lip up, like so. And if you're worried about being bit, just keep your finger along their cheek always. Don't let it fall over the occlusal plane or the biting plane. So not here, here. Then they can't bite you no matter how hard they try because you're over by their cheek. Also, if you're worried about being bitten, you can use that brushing buddy to help them stay open. As I alluded to earlier, there's also one spot that sometimes gets irritated. You can get a little ulcer there, and it can turn a good brusher quickly into a fearful brusher, and that is the top lip frenum, or this tissue right in here. I'll show you a graphic because it's a lot more prominent usually in babies. It's low down, close to the teeth, and you can bump it with a toothbrush and it hurts. The tissue shown here in this graphic is called a maxillary frenum. It connects the top lip to the gums. It's a normal piece of anatomy that everyone has, and it's often very prominent in infants and young babies. This new fad though of labeling these lip ties and lasering them at the dentist for hundreds of dollars cash usually is, in my opinion, misguided. It's not really supported by evidence, so word of caution there. That's another video though for another day. But this tissue is very sensitive with brushing. So when you're brushing, use your finger to retract the lip up, cover that frenum, hold the lip up out of the way so that you don't brush over it. And when you're brushing, use up and down motions instead of side to side motions. That could irritate the frenum. And you want to just be sure you're able to get along that gum line. Some children have a tented frenum. I'll see if I can find a picture of that, but where it's very thick, it almost looks like a whole separate little flap of tissue, and food and milk can get trapped up under there. And if it stays there and you're not cleaning the plaque underneath it by lifting that lip up all the way, it can increase the risk a little bit of cavities. You can lift that lip up and clean it well without the need for an expensive, often cash not covered surgery, and it creates a wound that is painful with healing. But again, I digress. These lip frenum releases, I'm not a big fan of. In terms of brushing motions, the tried and true modified Bass method, where you angle the brush slightly down or up toward the gum line at an angle of 45 degrees if we're being technical, but don't worry, I'm not going to come measure you with my protractor. And then you gently move in small circles across the teeth. You also want to use pretty gentle pressure. Not so gentle that it's not going to get into the embrasures, which is these little triangles between the teeth. If you brush too gently, you see how the bristles don't go in there? You have to brush hard enough and at an angle so you clean down into those little triangles right here, those embrasures. But you don't want to brush too hard. You can make the gum sensitive over time as an adult. Even if you're brushing too hard, you can even wear away enamel. Gentle circles, but enough to get into that little embrasure. Once your child graduates to an electric brush with 30,000 plus movements, which means it's not a simple battery-powered one, but it's actually an electric rechargeable one like Oral-B or Sonicare, you can then let that brush do the work by simply running it along the teeth. You don't have to scrub in the circles. Why that 30,000 mark is, 30,000 movements or more of that brush, it's getting your teeth sufficiently clean. But under that number, that's sort of the line they've drawn in the sand. Less than that, if it's just battery-powered or Quip as another example, it doesn't have quite enough movements. They still want you to be doing the circles and brushing more like with the manual toothbrush. Most kids, they don't tolerate an electric brush until they're about age 3 or even older. Can your child use an electric toothbrush? Yes, as long as they're not biting down on that brush head. That would be one indication to delay, is if they're chewing or biting on that brush head because of that movement. You don't want to create little microfractures in their teeth, and as long as they're able to tolerate those vibrations and that sensation. For most kids, that's age 3 or even much later. All right, you're armed with information and ready to go. I hope this was helpful. Please let me know in the comments below if there's any aspect of toothbrushing that I missed, or if you still have questions. You can check my TikTok and Instagram too at the Mama Dentist and see if I've already covered the topic there in short form. I have a lot more content there than I do yet here on YouTube in long form. If you're staying here and you haven't seen it yet, be sure to check out my 10 tips for toothbrushing success video so you know what to do if you suddenly find yourself in the midst of a toothbrushing standoff with a testy toddler.